Hi, and welcome to Community Builders, the podcast where we look for the helpers here in the Chico community. I'm thrilled to be here today with my guest, Mike Wiltermood, CEO of Enloe Health. Thank you for joining us today.
Well, thank you. It's good to be here.
So tell me a little bit about Enloe.
Well, we've got a long history here, particularly in Chico, but in the area we've been here since 1913.
Wow.
We get our name from Dr. Newton Thomas Enloe, who was the physician who started the hospital way back when.
Wow.
And ran it as a family business until the 60s when it was sold to a nonprofit community board, and we've been nonprofit and independent ever since.
And that's really interesting. I think that maybe not enough people know that. Enloe is entirely nonprofit. What does that mean for a hospital?
Well, yeah, that's a good question. Nonprofit doesn't mean we don't have to make money. Obviously, healthcare is a pretty capital-intensive industry. You know, we have buildings and equipment that we have to maintain and replace and upgrade periodically. But what it does mean is that we have a charitable mission to the community. We work hard to make sure that money doesn't get in the way of people getting health care.
That's awesome.
And, obviously we have to deal with insurances and billing and all that stuff. But that's our main mission, is to try and improve the health of the community and make sure we're there for them.
And tell me about your staff and the people there.
Oh, amazing staff. It starts with our doctors and nurses, who are just incredible people. We have about 5,000 employees and affiliates, and a super group of volunteers that help out as well. All capacities, all stripes. We have a very diverse group when it comes to skill sets, a lot of licensed people.
Wow.
Just folks that really embrace the mission and want to do what's right for the community.
Yeah, that's like 3% of the whole population of Chico is employed by Enloe, which is incredible.
Yeah, there's it's probably hard to find somebody who either doesn't work here or knows somebody who does. Right?
Yeah. And so how does being a nonprofit hospital, what is the difference for the patients or for the community versus a hospital that is for profit?
Well, I guess the simplest way to put it is we make money to be in healthcare. For-profits are in healthcare to make money. Yeah. Now, there's some great for-profit organizations out there that do a wonderful job. I'd like to think that, our mission is first to take care of our population and ensure that people, as I mentioned, can get health care regardless of their financial capability. I don't know how many for-profits are like that. Many do have a mission. I'd like to think that those of us that are in healthcare are in healthcare for the right reasons. So for-profit, not for profit, I hope it doesn't make a difference.
Yeah, that's a good answer. You've been CEO since 2007, is that?
Well, yeah, I'd like to think that I have been CEO since 2007. In reality, I came here as a chief operating officer, and the day I arrived, our CEO, the CEO who hired me, Debbie Yancer, had a terrible accident and broke her neck. And so she had a tough time recovering, but the team pulled together and supported her. Ultimately, she wasn't able to recover fully. And at least to the point that she could continue to take on that demanding job of CEO. And so officially I became the CEO in 2009.
So what does your job look like? What does the CEO of a hospital with 5,000 employees do?
Well, I get to work with some really incredible people. Probably the most important thing that I do is help facilitate strategic direction for the organization. Look out ahead, make sure that we have the capacity to take care of a growing and diverse community. It's every day is, you got the usual emails, papers to sign, contracts to enter into, capital budgets to approve, things like that. I suppose for me, it works primarily on the financial side, but I get to work with some really great clinicians, particularly the medical staff leadership.
Oh, cool.
And make sure that, we have the right kinds of specialties and the number of people that we need and in each specialty, as well as the support staff to take care of folks.
So that's really interesting. So you basically look at your staff and you say, we're missing this specialty radiologist. And then is it your job then to kind of find that person and to recruit them?
Yeah, absolutely.
Wow.
So really that dynamic has changed over the years. It used to be, and our area had kind of a golden age in the 70s and 80s when physicians just came here, set up their own private practices, put out a shingle, and used the hospital for their patients that needed inpatient services. Since then, more and more hospitals and physicians have a closer working relationship, and it's getting more and more where physicians are part of the hospital ecosystem, whether they're contractors. In some states, they're employed by the hospital, and so in that sense, we've really been working hard to build the medical staff component for the community. And that falls largely on the shoulders of the hospital and the physician leadership to make sure that happens.
And so you've been in healthcare since before you were CEO and COO. When did you start in healthcare?
Well, I graduated. I got my master's in healthcare administration back in 1986 after a year residency up in Washington State in Seattle, and I've been in the business ever since.
I'm assuming, and you even kind of alluded to it, you've seen some changes in this time.
Oh yeah. I mean, the most interesting thing that the industry has gone through, really, and I mean, since the inception of the Medicare and Medicaid program in the 60s, was in 1980, the government really realized that they couldn't just pay what hospitals and doctors charged them. And so the government set up systems to kind of capitate payments. Back when I first got into the industry, I think healthcare collectively was about 5 or 6% of the gross national product, and that was supposed to be unsustainable then. And it's about 18% now.
Oh my God, I had no idea it was that high.
1 in 5 people work in healthcare in some capacity, it seems like, in the United States. And so, with the baby boomers getting older and, a relatively smaller tax base supporting people that are on social welfare and Social Security and Medicare and Medicaid, it's understandable why people are concerned about the cost of healthcare now. And a lot of the changes that we've seen over the years have been attempts to rein those costs in.
Yeah.
We haven't been super successful, unfortunately.
What's the writing on the wall for that? What does that tell us about, the future or near future?
Well, that's the subject of a lot of conferences and articles and books, and people smarter than me, really, that are attempting to try and reconcile this.
Yeah.
I don't know the answer. We have a lot of regulations in our industry that certainly add to the cost, but when you dive down deep into the reason behind a lot of those regulations, it's to keep people safe, whether it's the approvals for drugs or equipment or the education required for licensure for a doctor or a nurse. It's an expensive proposition, and our hope locally is that we can do things as efficiently and effectively as possible so we don't overburden the population.
That makes sense. Are you optimistic about where anything's headed right now?
Well, yeah, some of this stuff, the technological improvements have been super. In fact, we're applying for a grant with the state of California to be able to provide an innovative treatment for autoimmune diseases as well as cancers and things like Parkinson's disease, where your own blood is genetically altered, reinfused back into your body to cure yourself of the disease. It's an incredible, what's going on in biology right now is way over my head, and it's just incredible. And we're really grateful we've got the talent to be able to bring some of those services to this area.
That's exciting.
Very exciting. We're just thrilled to be in the running for this grant. It's a $10 million grant. It's in concert with some efforts at UC Davis.
Okay.
Dr. Sam Maj here, one of our medical oncologists and one of our physician leaders is really leading the charge with Tracy Hunt, Julie Martin, some other folks at the hospital.
Excellent. Thank you for shouting them out. Those are all wonderful people. For this technology conversation, I want to talk a little bit about our new comprehensive cancer center. Can you give me like a bird's eye of what's going on with that?
Well, we're almost ready to open. We're getting all the finishing touches put on to assume occupancy. It's a 100,000 square foot building. The latest and greatest technology is in that building. It's actually one of the reasons why I think the state encouraged us to apply for the grant I just talked about. They see us as being pivotal to bringing that technology to all of Northern California, particularly in the rural areas.
That's awesome.
So we're really excited about the opening. We're going to be offering a comprehensive support services along with the treatment services, and that is through a grant from the Aaron Rodgers Foundation that's going to get that started. Once we get the certificate of occupancy, which we expect any day now, it'll be a couple-month process to staff and stock the building and then get approvals from the state for the licensure of the building. We expect to see the first patient probably in August or September.
It's fantastic. It's so exciting for this community. I'm a huge proponent of that kind of stuff coming to this area and being able to deal with that stuff here locally. Do you think the community is excited about this?
Well, yeah, we hope so. I mean, we've got so much community support.
Yeah.
In addition to the 13 acres that Merriam Park donated us through Dan and Don Gonzalez, we've raised well over $20 million for this project. So the community support's been phenomenal.
Yeah. What does having this kind of a new frontier in this area, what are the implications for the future of Chico to be able to do this kind of thing here more?
Well, you mentioned earlier the cost of healthcare, and some of the things that we may have to do in order to get the cost down is consolidate services and regionalize them. And so this building and the cancer center for sure gives us an opportunity to provide more of a regional service, be able to reach some of the communities that maybe have difficulty recruiting physicians or that don't have hospitals or clinics. So I think that's exciting. It's another indication of the broad scope of our responsibility to the community that we serve here.
I think that cancer is a big thing here. We have a higher rate than other communities around here, and I know there's it's not fully understood. Is it much higher in Butte County, and which cancers? And
there's kind of a fortunate and unfortunate aspect to this. The unfortunate aspect that you just mentioned is that the rate of cancer is higher in these counties, in Butte, Tehama, Glenn County, the counties that we serve, than any other part of the state by 30 to 50%. That's an incredibly high incident rate. The worst part about it, though, is that too many people are being diagnosed in the emergency department with late or later stage cancer, which makes it much more difficult to treat. And so that's the challenge of this new building and the programs that we're entering into and the conversations that we're having to try and meet those challenges. The good news is that these cancers are eminently treatable. I wouldn't say that all cancer is scary, and it should be. We need to take it very seriously, but we're talking, lung cancer, prostate cancer, breast cancer, colon cancer, cancers that are eminently treatable if we get to them early enough. And so that's our challenge. We've got to get to these cancers early enough so that we can get people cured of the disease. As far as why we have a higher incidence, anybody's guess.
Yeah.
We really don't know, but our job is to help educate people, provide proper screening, get people the help they need as early as possible.
If you're listening, get screened early, often. It's the best advice you could possibly give because, these are treatable now. It's not what it was even a few years ago, right? It has changed so much.
Yeah, absolutely.
Why did you want to go into healthcare in the first place? Like, how come you're not a BMX rider or something?
Well, yeah, besides being a professional athlete or a rock star, I guess healthcare was my third choice. But, in all seriousness, I grew up in an area that was a little bit underserved medically, a little bit impoverished. I spent some time in Latin America and saw some extreme poverty there. And I was always interested in business, but I wanted to get into something that I thought would have relevance. I've since learned that, every job can be relevant.
Yeah,
we can have a positive impact on people, but healthcare really resonated with me. I met with one of my professors at school and, just talked about the fact that the population was aging, the baby boomers were getting older, so it looked like job security as well. But to be able to work in a place like this, where there's a real definable ecosystem within the health services that we provide in a community that is very close-knit, to me, that's just nirvana. It's the best of all possible worlds to be able to work here.
What is something you wish this whole community knew about Enloe?
Well, we hope that people know that we really do have a sense of mission, that we appreciate their support, and we certainly aren't perfect. We want people to know that if they have concerns, that we have there's no wrong door to try and get help, and we are doing everything we can to provide the services that they need and keep the costs as low and sustainable as possible. So those are the main things, I think, that we just want the population to know that we're there for them. And, while we may not be perfect, it's not for lack of trying. Okay.
And I don't think anyone's expecting y'all to be perfect. And if you are, you're in for a bad time because nobody is. Why Chico? Tell me what you love about Chico, this community in particular. Why here? How come you're not in Chicago or New York?
Well, from a professional standpoint, to be able to work with a hospital that is central and key to a population, I think is just really exciting and satisfying. I mean, I have worked in some of the metropolitan areas where there's a hospital on every block, and I suppose it's still a good job, but it's not as personally fulfilling to be in that kind of environment. As far as Chico goes, that's a little bit of a longer story. I grew up in Lincoln near Roseville, and
not too far away.
And a lot of extracurricular activities were up here. At the time, Lincoln was about 2,500 people, and I think Chico was probably 20,000.
Wow, yeah.
But it had a McDonald's and street lights and a lot of excitement. So as a kid, we loved coming up here for things, whether it was a school event or something else. Years ago, when I first had my first job, was up in the mountains in Portola. And the CEO at the time here at Enloe, Jim Sweeney, used to invite some of us small hospital administrators to come for lunch and commiserate and talk about how we might work together. And, my wife, Kelly, came down and saw the art world and the university. And she said, man, wouldn't it be great if we could work here? And I said, hon, these jobs are real competitive. I didn't want to get her hopes up, but 25 years later, it was like the opportunity came up, and,
wow.
We were in a situation where we were a little upside down on the mortgage. That was about 2007 when the markets fell. And I said, well, there's this job available in Chico, but I know we're upside down on the house. And she goes, I'll take care of the house. You get the job. So.
Oh my goodness, that's amazing. That's a great story. What was the interview like? Like, what was showing up to apply for that job?
Well, again, just I don't know why anybody wouldn't want to work here. I mean, Chico and the surrounding area is so great. The people are great. And then having the responsibility of running a hospital in an area like this it's a huge responsibility, but it's so fulfilling, and we get so much support. That was a lot for me, and knowing that it was a place we still had one child left out of 4 that was still here. We were able to raise here. That's just been super opportunity for him to be able to go to school here, high school here, and ultimately Chico State.
Awesome.
It's just been great for our family.
Yeah. You mentioned the previous CEO of Enloe inviting other hospital personnel to come visit. Is that still something that happens? Do you meet up with other? Tell me about that. That's interesting.
Yeah. I mean, Jim Sweeney did that informally, and probably as a result, the California Hospital Association has divided us into groups.
Oh, fun.
So there's Northern California Valley and the mountainous areas as a group. So everybody north of here, we kind of form a little bit of our own hospital council and periodically meet either in Sacramento, or we trade hospitals. Like we went out to Quincy a couple months ago and met there and saw their new construction. And it's really nice. We're able to build a nice collaborative. We've helped each other out on occasion. I remember Plumas District Hospital having trouble with their OB program, and we helped them out there. We got an ambulance going for the hospital in Chester at Seneca. And, of course, Mercy Redding up in Redding also does a lot of nice things for some of the smaller hospitals in the region. And it's really, really collaborative. I mean, I can call any one of the CEOs in Northern California and know that, we're going to work to help each other. And it's not necessarily like that in metropolitan communities with a lot of competition.
And I mean, I love that story. Something I don't know how I would have known that without talking to you. It's so heartening to hear people in healthcare continuing to learn and to network and to meet other people and to hear what challenges they're facing, and then to help, across, different institutions like that. That's really, that's inspiring.
Yeah, and it's really a lot of fun. I mean, rural areas like ours in Northern California have some special challenges, and I think because of the collaboration we have an outsized voice when we talk to the legislature.
Yeah.
People understand what we're going through, and so if there's a law coming down that might have an adverse effect on us, usually we're able to get it tweaked a little bit so that our particular challenges are taken into consideration.
Yes, strengthen numbers and strengthen like a well-organized outfit like that.
Absolutely.
Tell me a little bit about your childhood. What was it like growing up in Lincoln?
In Lincoln?
Yeah, and how did it prepare you for what you do today?
Well, I had great parents and good coaches and teachers throughout my life. I was actually born in Glendale. We moved up early to the Bay Area, eventually Roseville, and then settled in Lincoln when I was about 10 years old. Like I said, it was a pretty rural environment, but that had some real advantages because I remember my first job. Literally I was 10 years old. I was complaining because my dad used to cut off all my hair every summer and I wanted a regular haircut. And he said, well, if you want to pay for it. So that led to the go get a job thing.
Yep.
And I got on my bike. I rode down the street rode down the country road that we lived on until I found a little horse stable, knocked on the door, said, do you have any work? And he said, yeah, you can clean horse stalls for, what is like a quarter a piece. And so that was my first job.
Wow.
And, I worked on a dairy. I worked on a bee farm.
Cool.
My brother and sister raised sheep in 4-H, and they typically worked for the orchards, picking and packing fruit. And so there was always those jobs, and they were hard. They were brutal. But I think it made us really good people and want to go to college, quite frankly.
So I heard in early financial responsibility nod there. I like that. How about were your family helpers? Were they imparting the importance of kindness and of helping other people?
Yeah, that's a really good question and a really good point. I think the fact that we were in a small town, we were all very close knit, and whether the help was formal or informal, when my parents heard somebody was having trouble, they were always there to help them, and I noticed that. They all, like everybody else, we all took turns volunteering for Little League and PTA and things like that, and so. Yeah, I think it was just embedded in the culture of the area, to see all those folks that would give back so much to the community.
Yeah, and I like the way you phrased that. I noticed that, right? Because it is, I think a lot of people, I'm of a 6-year-old, I think a lot of people feel like it's some sort of lesson. You have to like sit your child down and say like, this is how you act. But really it's that they're noticing how you act, right? And if you're teaching through the way you act, other people notice.
Yeah. In fact, some of those lessons, interesting that you say it that way, because some of those lessons sunk in my 20s and 30s.
Oh, interesting.
When I started, when I had my own family and I started having my own kids, and then for some reason I would hearken back to my own childhood and say, well, that's what Mr. So-and-so did, and that's what my mom did, or that's what my dad did. And then you start to really understand the reason behind it.
It's exactly right. And I had the same experience. Funny, you have a kid and then suddenly you start all of a sudden seeing your parents' side on all of these things. And you realize like, yeah, I'd like to just shave all your hair off because it's easier, but I could also use this as a teachable moment and get you what you want and, let you learn something that'll help you.
Yeah, absolutely.
Tell me about your family currently. You have kids.
Oh, yeah. So my wife, Kelly, and I have 4 kids. We, unfortunately, we encourage them to follow their dreams, so they don't live here. We've got our daughter Kelsey and her family's in Brooklyn.
Okay.
Kyle and his family's in Nashville. Savannah and her family are in Logan, Utah, north of Salt Lake. And then our youngest son is unmarried and living in Argentina.
Wow. Okay. Tell me about them a little bit.
Oh, wow. Well, we've got great kids. They're also, I think, very community minded and helpful. And, they grew up taking Christmas cookies to the nurse's station and doing all those things. And I think they're just really, really good people. We've got 6 grandkids now. And so they're all, they're in that stage of life, 30s and 40s, where they're, working on their careers and raising the kids and paying the mortgage and doing all that stuff. But we couldn't be more proud of them. We miss them. We try to see them as much as we can.
Do they come here for holidays or anything, or do you go to them?
Yeah. We just got back from Nashville. We try to set up at least one visit with them, and I maybe twice a year. And then sometimes we're able to get the whole family together around Christmas or 4th of July or something like that.
As we begin to wind down here, what is your advice to a young you? What would you tell yourself starting off in your career that you would appreciate today hearing?
Well, I think that growing up, I was very, very concerned about, how I was going to make it in the world, what career I should go into. I was kind of hyper-focused on that. And, there's a couple of words of advice I would give myself. One is that at the end of the day, it's the relationships that you build that are the most important thing. And, work's going to take care of itself. And I think I found that I've heard some really inspiring stories from people who set goals and reached out and achieved their goal. And for me, it really wasn't like that. It was having kind of a broad interest in something, maybe like healthcare, or knowing that, I needed to I wanted a family and I needed to take care and provide for them. But it's just kind of interesting how, it seems like in my life's path, those things have always just kind of sorted themselves out. And my wife has been really instrumental in that. I mean, we've had some tough situations, as all couples do, and she's always said, it'll all work out, and it always has. And I think the most important thing is just to make sure that, you're ever mindful of the relationships, the people that you come in contact with, because that's what really matters.
I could not agree with that more. And it's something I'm, still learning to this day, the importance of that stuff. I think that I didn't realize growing up how people just continue existing all the time, and jobs come and go. But if you can forge a good relationship with someone, and I should say the same for my wife, she's been incredible in the partnership we have to be able to overcome anything that comes our way. I wouldn't want to do it alone. And then beyond that, every friend, every teacher, every, professional acquaintance I've made, infinitely more like long-term value than any one job. And yeah, I didn't start off in horse stables, but I was on Mangrove Round Table Pizza at age 14.
Good job.
Not realizing that. Yeah. Mr. Wiltermood, thank you so much for what you do in this community where I live, where my family lives. Thank you for being a community builder, for helping, and thanks for joining us today. I really appreciate you coming on this show.
Thank you very much.